pass you on to my colleague, Sarah.
Welcome everyone and good morning. I am Sarah Connell and I am a Senior Inspector in the Early Learning and Childcare team. With me today is Anne McIntosh and Katrina Kennedy, who are both Early Years Inspectors. Jackie Dennis, our Senior Infection Prevention and Control Improvement Advisor, is here to assist in answering any infection prevention and control questions. We also have Lisa Kirkbride and Louisa Walker, the ELC team managers, with us to monitor the chat and contribute to any questions. So back to the slide, please, and the objectives of our session today are to share our findings from inspections carried out between October 2020 and June 2021. To signpost you to good practice guidance to improve outcomes for children, and to give some key take-home messages. We have analysed the latest requirements made during inspections, and we want to share this learning with you to support you to develop your service. The aim of this session is to be helpful and informative. We know people are tired and have had a hard 18 months, and we would like to take this opportunity to express our thanks for all the work you've been doing and continue to do each and every day. Next slide, please. There are approximately 3,600 daycare of children's services registered with the Care Inspectorate, caring for a maximum total of 179,000 children across Scotland. We completed 281 inspections from the 1st of October 2020 to the 30th of June 2021. It is important here to mention that most services were evaluated as good or better. However, this session is about highlighting and sharing with you the trends where requirements for improvement were identified. And we realise that a lot of you won't have had us, walk through your doors during COVID, and we thought that sharing this information with you would be helpful. So hopefully by informing you of the common issues, you can use this to reflect on your own service. We know that the majority of you will not have had a Key Question 5 inspection, and we think that sharing this learning will be beneficial. So whilst we have moved from Key Question 5 inspections back to themed inspections, we will still assess infection prevention and control to support children's health and well-being under the quality theme of care and support. It is important to remember that COVID-19 has not gone away, and we need to learn to live with it. You will have seen on the news this week that cases are on the rise. We recognise that the restrictions on groups have eased. However, this was one aspect that we made requirements on during inspections, and we will need to be mindful of this if we have to reintroduce levels and cohorts at any point. We need to ensure that we can respond to the community prevalence of the virus and local protection levels if these are brought back in by the Scottish Government. Throughout this session, we will talk through the main areas and give you helpful guidance and reminders. So let's now look at the key areas in more context on the next slide. Next slide, please. Thank you. In this pie chart, you will notice that infection prevention and control issues were the most common in these inspections. This included concerns about hand washing, incorrect use of PPE, personal protective equipment, not following appropriate procedures when a child displayed symptoms, inappropriate use of alcohol-based hand rub, not having risk assessments in place, and enhanced cleaning procedures not being in place or being followed. The next common concern was knowledge and understanding of COVID-19 guidance. For example, the safe deployment of staff and the staff's skills, knowledge and experience of general COVID guidance. And the third most common theme was quality assurance, which links to both infection prevention and control and knowledge and understanding of COVID-19 guidance. For instance, we noted that there were times when management had not monitored staff practice to ensure that COVID procedures were being followed. So this pie chart just gives a little more context to the common themes of requirements. Next slide, please. So what are the resources that are available to help you with the top areas for improvement? We launched the Key Question 5 self-evaluation document and ran bite-sized sessions to support the self-evaluation of your service. These are still available on our website and well worth a look. They're short and helpful, so we would advise you to go and check those out. We've created and continued to send out provider updates, and you can sign up for those on our website. We've delivered COVID-19 webinars in partnership with colleagues from public health and shared the lived experiences of children, staff and providers and services. We developed our frequently asked questions and created a compendium of COVID-19 best practice guidance. Our inspectors increased support calls to services during the pandemic if they were operating, and we would like to remind you that your inspector is still here to help. Please reach out to them and make contact if you ever need advice. Next slide, please. So this is something that's just quite helpful to make you aware of. Our first signpost to good practice is the Scottish Government COVID-19 data site. We've got a couple of links in the slide there, but we will send out all links to you after the webinar in the next few days, so please don't worry if you can't click on things. These links would allow you to see transmission rates by age group and local authority. So it would be a really good idea to access this information regularly to keep you informed of the transmission rates and if there are any protection levels in your area, and that will help you to respond appropriately to them. The Scottish Government has been clear that the protection levels can move up and down as we navigate our way through the pandemic. The updated guidance for early years in relation to COVID-19 indicates that you may need to adjust your policies, procedures and risk assessments as and when the protection levels change. So for instance, at level 0 at the moment, you can revert to your conditions of registration for your numbers of children. However, if the local protection levels change, that may influence how many children you can care for. Next, we will take each common area from that pie chart we just saw, and we will signpost you to good practice guidance. Can we please stress again that COVID is still out there and we just really need to be mindful of that. Next slide, please. The first guidance document we would like to signpost you to in relation to infection prevention and control is this one. The Scottish Government Guidance for ELC Services, which can be accessed on their website. Check this guidance regularly because it changes. It's not worth printing a copy, but if you prefer to read from paper, you will need to regularly check that you have the latest version. So if you see that the published date or last updated date has changed, then there's something within that document that you need to be aware of. And the government were quite good actually at putting an overview at the start of any major changes to their guidance, so that was really helpful for everyone. This document relates back to that common aspect in the pie chart that we saw earlier, which related to staff's knowledge and understanding of COVID-19 guidance and putting it into practice. In terms of infection prevention and control, the concerns we identified during inspections were the effectiveness and frequency of hand washing. Young children often need support and reminded to keep washing hands for 20 seconds and then also to dry their hands properly. And believe me, we do know how hard that can be. I've got a 7-year-old nephew, Adam, whose hands barely touch the water, and he comes out the toilet really proud that he's washed his hands. And you've got to remind him and urge him to pop back in there and do it properly. He's got far more important things to be getting on with, such as karate and pretending to be an Avenger. So we do have to check him and remind him to do that. We also noted that the storage and wear and care of face coverings was not always in line with the guidance, and we've observed things such as face coverings scrunched down around people's necks, around their water bottles, or hung on lanyards, and that's just to give you a few examples. And it's so important that your face coverings are kept as clean as possible and stored correctly and laundered or changed regularly, and that just keeps the viability of the mask as best as it can be. This guidance also includes how to support a child who is displaying symptoms of COVID-19. And it's really important that all staff know about this guidance and your procedures in your own setting and the test and protect arrangements. The more people working in the service who are up to date with the guidance, the more likely it is that everyone will work in line with it. When we visit your service, we may ask you to explain your procedures in your setting, as these can differ depending on the layout and the local protection levels if these are reinstated at any point. Next slide, please, Stephen. The infection prevention and control and space to grow documents are helpful and relevant pieces of guidance. We recognise that the infection prevention and control and ELC settings document has not been reviewed and updated in a while, and we have highlighted this to the Scottish Government, so hopefully we will see an update to this document in due course. During our inspections, we highlighted that improvements were needed in the use of alcohol-based hand rub. Alcohol-based hand rub is discouraged for use in children under 5 unless there's no other option, and should not be used for children under the age of 1. Public Health advises that soap and running water is best. If there is no running water, hand wipes may be used, and if these are used, then it is recommended that children's hands are washed with soap and water at the earliest opportunity. A hygienic environment and enhanced cleaning has also been recognised as an important area in some settings. Most often, we observed that staff did not undertake the cleaning of touch points and failed to adequately ventilate areas. On some occasions, there were not enough staff or protected time to enable staff to maintain a hygienic environment. And that's really important that managers and providers take that into account with their staffing to, make it as easy as possible and offer help so that staff can make sure they can do those duties that are asked of them. The Scottish Government still advises that you minimise the amount of clutter around the building, and especially in playrooms. So, make life a little easier for yourself and do a spring clean, so to speak, every couple of months. We know how quickly items can get piled up on worktops and shelves and windowsills, and I'm sure every service out there's got that one cupboard that's the bane of your life, where you can't find anything. So keep on top of it, and that'll really help you. It's the very reason I don't have many ornaments in my house, because it's less to dust. We would also like to highlight in the infection prevention and control document at the top left there that the appendices are still useful as they include exclusion criteria for infectious diseases, a helpful checklist in the case of an outbreak. There's posters on effective hand washing, and Appendix 10 contains guidance on how to keep toys and equipment clean. And lastly, there is helpful information found in the Space to Grow document, and section 2 highlights the importance of a clean and hygienic environment. Next slide, please, Stephen. So while we are no longer carrying out dedicated Key Question 5 inspections, 5.2 will still be considered within our themed inspections under the theme of care and support. 5.2 considers how infection prevention and control practices support a safe environment for children and staff. When we move to the quality framework for daycare of children, childminding and school-age childcare, for inspections, Key Question 5 will be incorporated where appropriate. Key Question 5 is designed to help you to self-evaluate and consider how you will maintain COVID-safe practices. By now, you should be familiar with this document and how it affects your practice. Key Question 5 is designed to help reassure you of the things you are already doing and to keep children safe and help you to see any gaps that you may not have considered. If you need some help with this, there are bite-sized resources on the Care Inspectorate Hub. Go to the Early Learning and Childcare Improvement section to find this, or sometimes a quicker way is just Google Care Inspectorate Bite Size and it should take you to that page. As we said earlier, these are only 5 minutes long and you may find them really useful. You will want to return to your Key Question 5 self-evaluation and update it as we learn more about living and working with COVID-19 in our lives. So we change of voice for you, everyone. We've got Katrina. I'm going to hand over and she will continue with the session for you. Thank you very much.
Next slide, please. Good morning, everyone, on this bright, sunny, shiny Thursday morning. The Scottish Government Personal Plans legislation requires providers to create a written plan in consultation with the child and, where appropriate, their parents. In daycare of children's services, it is always appropriate to consult with the parents. The plan should detail how the child's health, safety and welfare needs will be met. When updating personal plans, we found some services were not considering children who may be more vulnerable to COVID-19 due to health reasons. These children will need an individual health risk assessment. This is something to create with parents to show what measures you will put in place to keep their child safe and healthy. You can find more information on this under the care and support for specific groups within the Scottish Government ELC COVID guidance document. If children have been absent or your service needed to close due to COVID-19, you should check the information is still relevant in the child's personal plan. An example from a recent inspection, a child developed an allergy when the nursery was closed due to COVID-19. Only one staff member was told about this on the child's return. The personal plan was not updated. While the staff member was absent from work, the child came into contact with the allergen and had a very bad reaction. This tells us and should remind yourself that communication is key. Even though you may know children really, really well, and we know you do, you still need to check the information from home regularly and update that personal plan. Can we have the next slide, please, Stephen? We found that some services did not keep accurate attendance records for children. This is so important for Test and Protect. Providers must keep records of children, adults and staff attending their settings and of the composition of groups undertaking activities. If you can't be clear on this, you may find that everybody needs to isolate. These records will help to ensure rapid response and contact tracing should a positive case occur. This will enable you as employers or managers to maintain records on staffing capacity in individual settings. Weekly staff absence forms should continue to be submitted. Scottish Government use these to inform their decision making with regards to restrictions, so please keep submitting them weekly. All providers should plan as much as possible to minimise the operational impact of individual groups, staff or groups of staff being required to self-isolate. We know that beyond zero, there are different expectations around self-isolation. However, we must be ready to respond if levels are reintroduced. And if you listen to the news, as Sarah was saying earlier, you can hear that it's coming. Web links to this document will be sent out after the webinar. Could we have the next slide, please, Stephen? Some services had not considered how COVID could make children more vulnerable. There may be children who were not considered vulnerable before the pandemic, but they may have been put at risk as a result of lost jobs, income reduction, changes in family circumstances, and parents or carers' illness and poor health. Children who are already known to us as vulnerable may be more at risk when they have to spend longer at home. Do you know if your children are on the Child Protection Register or in kinship or foster care? Have you asked? It is perfectly acceptable to ask these questions. If your service needs to close due to an outbreak, you should tell the child's social worker or health visitor if you have a concern. Are your records secure but accessible if you are off isolating or if the service has to close? Who is responsible for organising this? These are just some of the questions we would like you to consider. Could I have the next slide, please, Stephen? While COVID risk assessments are mostly in place, some staff did not consistently apply these in practice. You can have a really good risk assessment on paper, but it needs to be carried out in practice. For instance, during conversations, staff demonstrated an awareness of the need to physically distance and wear face coverings when this was not possible. However, during busier times, such as when serving lunches, we often observe staff working closely together without putting any mitigations in place, such as wearing the face coverings or taking a step back. Risk assessment should cover all risks identified in respect of COVID-19 and must take account of all relevant guidance. A risk assessment should be a working document. It can be written or it can be printed. As long as it's written down, be revisited as things change in your setting and guidance is updated. It must clearly identify risks and mitigations and any control measures you've put in place to reduce the risks. It should be shared with all staff, parents and children where appropriate. As we all know, one size does not fit all. Your risk assessment is unique to your service. For example, when you're taking account of the layout and how groups are managed if still in place, individual children's needs, your deployment of staff and their individual needs. Some things you might want to consider or think about are what would inform your risk assessments? How would you respond if your local area was going up a protection level? Are you checking the relevant websites for your setting, such as and not limited to the Scottish Government website, the Care Inspectorate website, Health Protection Scotland, and the Health and Safety Executive? The Scottish Government sets out good advice for risk assessments throughout the whole COVID guidance document. Could I have the next slide, please? Having an outbreak of COVID-19 can be an extremely worrying time for you, and we realise that you will have a lot going on at that point. Your inspector may call you when this happens. This is to offer you support, so don't be alarmed if you receive a call. It doesn't mean that you have done anything wrong. Sometimes we are not notified through e-forms of a suspected or confirmed outbreak, and quite often people forget to tell us about the end of a suspected or confirmed case. The COVID-19 notifications for the Care Inspectorate we need are a suspected outbreak notification, a confirmed outbreak of COVID-19 notification. We also need the end of a suspected outbreak notification and the end of a confirmed outbreak notification. We also, if there's changes to your service delivery due to COVID-19, we need this at the start of closure, and again when you reopen. Could we have the next slide, please, Stephen? Quality assurance systems help you to identify and build on good practice and make changes where needed. They allow you to support staff by identifying what they do well and what they could do better. Sometimes we don't know what we don't know. Receiving feedback on your performance is vital to making improvements. During inspections, we noted that staff practice was not being monitored routinely, and therefore some issues were not being picked up. For example, washing hands for less than a required 20 seconds, that was staff and children. We also noted on a number of occasions that we were lifting babies from behind with no warning, and just a forgetfulness of our previous good practice that we've instilled. And we could understand that the COVID bug has gone around, we've got COVID chaos going on. We also noted things such as wearing face coverings around your neck or storing them around water bottles, which I know Sarah's already mentioned. If quality assurance is ingrained in your practice, small issues will be picked up and dealt with quickly before they become bad habits. Some managers told us that monitoring was not carried out because they did not want to enter areas unnecessarily in line with the COVID guidance. However, we also found some very good practice that we wanted to share with you where managers had found ways around this. Managers had used iPads or laptops to observe virtually from the office. We found some managers observing through open windows, or agreed between members of the management team who would observe in each area with risk mitigations in place. Leadership and role modelling is vital, and people regularly need feedback to ensure they can develop and grow as a practitioner. Next slide, please, Stephen. We would like to remind you about our provider updates. If you'd like to sign up for them, you can do this on our website. Please keep checking Please keep checking that you're receiving them and sign up again if you are not. We knew that there was a small update ran at Christmas, which knocked some people out. So please check to make sure you're still receiving them. In addition to the guidance we have already mentioned, the slides that follow will show you where to access additional information you may need. Please be reassured we will be sending out a copy of the slides with all web links mentioned and the question and answers following the sessions. Could we have the next slide, please? Frequently asked questions will remain on our website for now. We aim to update them every 2 to 3 weeks. However, if there are big changes in the guidance, then updates can take us a bit longer to ensure we get clear answers to you. So please bear with us. We're trying our hardest. Next slide, please, Stephen. The compendium can be found on the Care Inspectorate website. It is a quick link to relevant guidance, and it's divided into sections based on specialisms. Scroll down until you find the ELC section in section 4. This will remain in place on our website. However, we are aiming to have a separate ELC compendium, so watch out for that coming in the near future. Go to the next slide, please. The Parent Club is a Scottish Government website and is a good source of information for parents. We have found it can also be a source of good information for service providers. Could we have the next slide, please? We wanted to highlight these websites which will be useful to you. The Care Inspectorate COVID-19 page, the Care Inspectorate digital portal for any changes to your conditions of registration, the NHS Reform website for COVID information. Could we have the next slide, please? Anne and Sarah have been monitoring the chat. We will now have a short question and answer session. Any not answered questions will be typed up and sent in the next few days. Anne, are there any questions that we can answer now or that would be helpful to share with the wider group? I'm sorry, Anne, we can't hear you.
Okay, can you hear me now?
Yes, we can.
Okay, so we've had several questions around lunches, asking if children can help prepare snack again and self-serve their lunch. So the answer to that is yes, we can return to that good practice that develops children's independent skills. You just want to remember that effective hand washing that you've talked about and good cough etiquette, make sure that's in place. Children should be directed to wash their hands as often as needed to minimise the risk of cross-contamination. And you may also wish to have a smaller group of snack helpers so that staff can adequately supervise that good hand washing. And if anyone else in the panel would want to add anything to that, you can do so.
No.
We answered that, okay.
Lovely, thank you. And we have had some questions around cleaning. So the question was, do we still need to continue with enhanced cleaning and rotation of toys each day, especially as we are just one cohort now? So I assume this is a sort of smaller nursery or an open plan playroom where all the children are now merged together. However, yes, there is still cleaning needed, and there is a table within the Scottish Government guidance, and that lays out what the level of cleaning is that is needed depending on the protection level. And if we're at level 0 and beyond, at the bottom of that table, there's still information about what cleaning needs to be in place anyway. So toys and equipment that children access should still be cleaned daily. Or if groups of children are changing during the day, then on a sessional basis. And we had a question that cropped up in the Q&A box as well about the frequently touch points, the high touch points, and the guidance did say twice daily cleaning of high touch points, and it says that there's more regular disinfection needed than what would have been in your cleaning regime, you know, pre-COVID potentially. So if you were doing that twice a day, you might go to once a day, for example. But again, that will depend on you, how many people you have in your service, what's going on that day, how many visitors you have. So it's all about you assessing that risk and making sure your environment is as clean as you can get it, because that's nice for everybody. It keeps everybody safe. So is there anything that the panel would like to add to that answer before we move on to the next question? Nope, shaking heads, lovely.
We also have a question with regards to sand, water and Play-Doh. And we're really just going to say that water and Play-Doh should be replaced daily, or if groups of children change during the day, it should be changed on a sessional basis. We recognise that sand is expensive, so should be replaced using a common sense approach. However, if an outbreak occurs in your setting, sand should be removed and taken away. The IPC for Childcare Services Appendix 10, which was our old book, which is still perfectly appropriate. The standard 10 for your has a standard for cleaning toys and equipment. So Appendix 10 is the one to look for there. Anyone want to add anything to that? Anne.
No, I think you've covered that, Katrina. We've also had a question, someone is looking for advice on trips and walks. We've had a few questions about that actually, and also can we use public transport and are we able to go to public places? So the answer to that is yes. There is a frequently asked question about this on our website. If you want to check this out, it will give you some hints and tips about going on trips. You may visit public places provided that you adhere to the current public health guidance for that area. I don't think there'll be anything to add to that. There's another question that Sarah's going to pick up.
Thank you. The next question, why are the Care Inspectorate asking us to submit a weekly staff absence notification? And I'm not sure if any of you were at the Public Health Blether on 19th of August, but the Scottish Government gave a really good answer to that, and so did our Chief Inspector, Catherine Agnew. And basically we're collating that information and sharing that information with the Scottish Government to inform their decision making around, for example, self-isolation rules. So they're using that to see the effects of the rules that they're putting in place on your staffing and your settings. So if you don't fill that in and you don't submit that information, then they're not going to know as well as they could do what they can then do to help you, or what they can then change, and they can see the effects of it. So we would urge you, really strongly, please try and submit that so that they can get a good understanding of what's going on in the services out there. So hopefully that helps to explain that for you. And also the Public Health Blether was recorded, and we'll send you out information of how that can be accessed. But if I remember correctly, I think it's going to be on the Education Scotland website, the recording. Can any of my panel confirm or otherwise with that?
Yes, it's going to be on the last time it was on YouTube, but it was linked to the to the Education Scotland website.
Lovely. Okay, so hopefully that helps explain that a little bit more to you.
Thanks, Sarah. We have had another question with regards to forest schools, and the question was, can we reintroduce forest schools, particularly transporting the children on the bus? And the quick answer is yes. The more time outside in the fresh air, the better. As I said previously, you may use public transport. There is guidance on dedicated transport within the ELC guidance, and dedicated transport can be viewed as an extension of your service, so just one cohort.
Thanks, Katrina. We also have a question that asks, why do children not have to self-isolate if they are a close contact of a positive case? So this decision reflects the relative risks of COVID-19 infection, transmission and harms amongst the under 18s, and the significant and sustained educational harms that result from current self-isolation policy. It aligns with the draft advice of the advisory subgroup and the views of the Chief Medical Officer. So children with no symptoms are statistically less likely to transmit the virus. This was discussed again at the ELC Public Health Blether, so it's worth trying to get connected to that, and hopefully we'll be able to attach a link when it becomes available and we send out our question and answer sessions.
Thanks very much, Anne. The next question is about visitors. So what are your thoughts around external visitors? Parents have been asking if we will be having a photographer this year. So that would be nice, wouldn't it? So yep, there's specific guidance with regards to specialist visitors within the setting, and at level 0 and beyond, we would be advising that if you were going to have a photographer in, that your physical distance from adults and where possible children would be really important. They might be in they should be in a well ventilated area, so you could consider your outdoor venues. You might have a lovely woodland or grass area near your nursery or your out of school club, where you could get some fantastic pictures with our lovely Scottish scenery that we have. And yeah, risk assess it, identify and any risks, and put your mitigations in place to make that as safe as possible whilst following the rules. And we hope you get some fantastic pictures of your children.
I think we also have a question here with regards to parents' showrounds. Well, the question is, when can we return to having prospective parent viewings inside the nursery? And it goes on to say, we have had virtual tours created to showcase the nursery and staff, but still find that parents are asking if they can come in and meet all the staff who will be caring for their child in person. And our answer to that is, we understand that some families may wish to view your setting in person. Where virtual arrangements for parental engagement are in place and working well, these should continue to be used. We can't stress enough that the virus is still out there and live. We would go on to say that, however, any visit should be planned in advance, and visitors should stay physically distanced from any other adults who are part of their household, from any other adults who are not part of their household. Visitors should aim to stay distanced from children who are also not part of their household, although it is recognised that some children may find this difficult. Visiting parents should be encouraged to take part in universal LFD testing prior to coming in, and visits must not take place if there is an outbreak in their home or in the setting, your setting. Anne?
Thanks, Katrina. We've also had a question. We are starting to get placement requests for school students. If there is a risk assessment in place, is this okay? Yes, is the answer to that. It's perfectly okay to have student placements within the service, and there is guidance on this, again, within the Scottish Government guidance for early years, so you can have your students back. Okay, and I'm just picking up some more questions in the chat. Someone has asked, what would you suggest a maximum cohort should be at this moment in time? Again, there's a table in the guidance for that in the early years, and what it says is when we're beyond level 0, you can go back to the what it says on your registration certificate, basically. But again, you know, if you can have groups in place, then they can still be useful, because you want to think about, if you have a positive case, how many people is that going to impact? So what would the result of that positive case be? How many would have to self-isolate? But that can also change as we move levels in local areas, so worth keeping an eye on that. Is there anything anybody in the panel would like to add to that?
Sorry, Katrina.
On you go, Sarah.
I was just noticing that Louisa popped in the chat a little bit about her framework. I wonder, Louisa, if you'd like to just come in and say that out in case people haven't been able to keep up with the chat.
Yeah, hi folks, thanks very much for coming this morning. Just to give you a quick update, and thanks for the questions in relation to the framework. There has been a soft launch for the framework, and one of the questions that was interesting was in relation to we're using 2 frameworks. What I would say to folks is, currently we're in a testing period for the framework, and there had been some information on our website and updates in relation to that. Once the testing period is finished, which would probably be mid-October, we'll be bringing together the information from that, and we'll be sharing that with yourselves. What I would say to folks is that this is a soft launch, that, you know, if you do get a chance, have a read. We would like to think that the framework will support you and help you in your thinking in relation to where you may be at with your service. But in relation to the Care Inspectorate currently using the framework as part of our inspection methodology, we are not using that just now, and once we have information in relation to that, we would absolutely make sure that it's shared with you before we would start using it. But if you do have any queries, don't hesitate to please get in contact. Thank you.
Thanks very much, Louisa. Katrina, did you have something?
Yes, there seems to be a lot of questions with regards to where to store your masks when not wearing them. So face coverings is the best place to keep it is in a dry, breathable bag, like a paper or mesh fabric bag, to keep it clean between uses. And when you're using your mask, keep the same side facing out.
Great advice, Katrina. Thank you very much. I've noticed a question. I'm the cleaning lady apparently today. It's cleaning again I've picked up on, sorry. I like my hinching. So it's about, are we expected to clean the outdoor equipment for sand and mud areas? So yeah, it's kind of the same as indoors. So if your groups are changing that are using the outdoor area, then it's the equipment the children are needing. So the spoons and the bowls and things like that they're touching. So obviously your outdoor mud and sand, you would keep that safe from the elements and animals that may come in your garden. But we would not expect you obviously to be replacing that every day or whatever. You would leave the sand out and leave that open to the air, and overnight that'll help to minimise any bacteria in there. But yeah, just keep giving the items a little clean as you go. So don't forget your outdoor areas, everybody. Okay, has Anne or Katrina got anything else that we can answer from the chat just now? And please be reassured, we are taking all your questions back. It's a little bit difficult to see them online and answer them quickly, but we will answer everything and get all answers out to you in a Word document later on.
Sarah, keeping on the cleaning theme, there's a couple of people asking about how to clean. So what can we use? Is fairy liquid and hot water okay? So I wondered if Jackie wanted to come in here.
Hi there, yeah, soapy water is probably the best if you've not got an outbreak. Obviously, if you have got an outbreak, you could use a combination of detergent and some form of chlorine base, especially around highly used areas. If there is a suspected outbreak or you're worried about a certain area. So, but generally speaking, if you're in a low risk pathway or there's no outbreak in your service, then soapy water is your best form of defence. Give the place a good wipe down.
Thanks, Jackie. I've picked up on a question in the chat, which I think is important to highlight. With the cases on the rise, especially in the area we are based, I assume it is also acceptable not to reintroduce children to preparing snack, etc. And absolutely, this is where we're going to have a little bit of up and down as we move forward, because if you remember back to full lockdown, where there were only key worker children in nurseries, all of that stopped. We had to be so careful about not spreading the virus. So what you will have to do is, depending on what level you're in and depending on your community prevalence of the virus, then you will have to make a decision about what is safe and acceptable to do at that point. So there may be little changes as you go, and that's where your risk assessments are going to come in so handy, where you just keep an eye on that. And as Katrina, I think, said in her presentation, your risk assessment can be a bit dog-eared and have quite a bit of change to it. But if that gets quite messy as time goes on, then freshen that up and have a new copy for people so they know where they stand. But as long as your team and your service know what you're doing at any given time and what the rules are and what the expectations are, then that's going to better enable them to keep themselves and the children safe. So hopefully that helps with that question.
Thanks, Sarah. We also have a few questions about soft furnishings. So people are asking, can soft furnishings such as sofas and rugs be used again? So the answer to that is yes. If you look at the guidance, again for early years, there is a table that tells you if we're beyond level 0, then they can be reintroduced, and you would just clean them following the manufacturer's guidance. But again, if you have an outbreak of COVID, you would want to be removing things and getting them cleaned immediately. And there is different guidance depending on what level you are. So if we move protection levels within your local area, then you would want to revisit that guidance and see what that means for the equipment that you have. Is there anybody wanting to add to that?
No. I could maybe come in and answer a question that's come up about our inspections and about observing staff virtually. So I would just comment that we're absolutely committed to carrying out our inspections safely, and we've worked with Public Health Scotland to enable us to do that. And one of the ways that we've been doing that is to spend a shorter amount of time actually in services, and to carry out some of our inspection activities virtually. And part of that has been inspectors doing some observations of children's experiences, or speaking with staff using virtual means, so over Teams or using Near Me. And we've actually found that's worked really well, and that's enabled us to have some really good conversations with staff and hear about all the good work that's going on. And we do take time to reassure people that they will have, you know, opportunities to talk to us about what they feel is important to them, and it often offers people the opportunity to do that confidentially as well, which people have been appreciating. So that is planned to continue. And what I would say is that if you have any questions around that, talk to your inspector at the start of the inspection, because the inspector will be setting out and working with you on the plan for the inspection. So if you've got any concerns at all, do talk about it with your inspector at the time.
Thanks, Lisa. We've got a question that I might need the panel's help with, just to double check this, but is it a requirement to have paperwork signed off to record the cleaning? If staff and SLT monitor the process, is there a need for records? Now, I would say no, if you're confident that your staff are doing the cleaning and you witness that happen every day, you've got a nice clean environment, and they know what they're doing within that cleaning, I would say no. But is there anyone else that's got any other things to add there?
No, I'd be happy with that.
Okay.
Answer.
Yeah.
I've only got one thing. It's about quality assurance. We're always on about people being able to quality assure. So I don't know, we'd be looking for something that, you know, that somebody has checked that those kind of things are in place. I don't know, from a quality assurance, from if you were a manager of a service and you do your walk round, or how often would that happen? You know, that kind of thing. That would be things we would look for.
Jackie, I would completely agree with that. As leaders and within your services, in relation to, you know, your service, you're having that walk round, you're seeing how things are going. We can go into services and find at times that we have a piece of paper that would be checked off and say it's, you know, the service is cleaned or the soft furnishings have been done, but actually when we look at it, that's not the case. So, you know, it's not a requirement in our legislation to say that you must have, but what we would be saying to you is ensure that's something as part of what you're looking at, to ensure, you know, outcomes for children are positive. But again, it's not a requirement in terms of writing, but as part of your all-round quality assurance, then we would be saying, you know, is the service, you know, clean and you know, clean and in terms of children's health welfare, and it's there. Yeah. Okay.
I think we're nearly coming to the end of our time now. Has anyone got any burning questions on the panel that they want to answer, or we will just answer all the questions and send them out, send the questions and answers out to people? I'm seeing some shakes of head in the panel.
Katrina, there's one that's quite interesting. At the ELC blether, it was said groups mixing outside is now okay. It seems from this conversation this is not okay. I've not picked up on that listening.
No.
And cohorts need to have resources cleaned in between in the garden.
There was still information in the guidance about children from different groups not mixing outside. So let us double check that, and we'll write an answer in the answers that we come back to you in. And if that's a contradiction within the actual guidance, we'll double check that with the Scottish Government before we come back to you. I think, is that okay for the panel if we do that?
Yeah.
Yes, seems sensible.
Lovely.
Okay, then we'll move on from there. A big thank you to Stephen, Leona and Jennifer for being uber efficient and keeping us right this morning. Can we have the last slide, please? We would like to thank you for joining us. We hope this helps you to keep safe in a COVID-safe way as we enjoy more normality and freedom in our lives. Please stay safe and cheery bye, everyone. Thanks for joining us.
Thank you.
Bye, everyone.
Have a good day, everyone. Bye.